changing that. And I made sure to click record so I don't forget. Let's see here. So yes, because I want to share my screen because I have a lot of questions. I actually have a couple things to show you guys today. Now I don't see the screen that I want. So I think I just have too many things open, ladies. So let me just close out of some of these things because I actually was working on a couple things for you guys, but I wanted to keep it short and sweet so I can make sure to go through everything. So where is my case studies questions? So ladies, let me just cancel out of a few things here. So I'm going to cancel out of the internet. I'm going to cancel out of, I wanted to show you guys a blueprint though for the case studies. So let me just cancel out of this. And I don't think you guys can see my screen yet, can you? Let's see here. Where are you? Yeah, I don't want you guys to see this because that's the answers. I don't want you guys to see the answers yet. Okay, let's try this. Okay, so I don't think it's quite 9 o'clock yet, so this is good. I think we're almost there, so I gotta hurry up. Okay. Does anybody have any questions before I get started while I try to figure out this screen here? Okay, I think I might have figured it out. Let's see, but that's not the one I wanted to show you guys. It was this one. Now, can everybody see my screen that's titled the Case Studies Review Session? Can everybody see that? Okay, good, thank you. Thank you for letting me know. So I think I figured this out. It's just very interesting why I can't see me. I mean, I don't need to see me, but I want to make sure that everybody can see me after you guys watch the recording as well. So let's move this back in the middle. Okay. So everybody is good, right? You should be able to see me and you should be able to see, so on my screen, does it say Case Studies Review Session? Because I have two different case studies, but I want to show you guys the Case Studies Review Session. No, okay, so you're looking at something else. Let's do a new share. There we go. So I switched it. Can you guys see it now? It should be like light blue and black lettering, Case Studies Review Session. Okay, good, thank you. Sorry for the confusion. It's just very interesting how, because I do tutor my Board Exam Prep Academy members every other Sunday, but when I have more than 30 people on, for some reason the buttons are different and it's just kind of strange to me. But as long as you guys can see this, I did click record, so that's good, and it's 9:01 already. So let me check my email really quick, make sure that nobody's having any issues coming on. And for those of you who were on last night, I do hope that that helped. I do have some harder case studies types of questions for you guys today. So they are a little bit harder. Some are easier too, but I put them in there so that it kind of leads to me talking about something else. Because I want to also show you guys, for those of you who have taken the board exam before, I want to show you guys how they actually mark the board exam, so you know sort of what to study. So I'll go through some case studies questions first, and then if I forget, please remind me to show you guys the blueprint before we leave today, because I do have that on another slide. Okay, so let's go through some case studies now. And for those of you who weren't here yesterday, how this works is I'm just going to go through questions. And if you guys could please type in your answers to the questions, so they're multiple choice, into the chat box. And somebody is saying that they can see Paula's messages, and that is okay. But if you want to send me the answers privately, you just have to click, on my screen, it's showing me a 2, everyone, but if you want to only send it to me, then you just have to click on that little button that says everyone. And then I don't know if I'm under by name, so I could be under Andrea Turowski, I could be under Andrea, I could be under Dentalelle. So click on that for your answer, so then that way other people can't see the answers. I mean, there's no harm though in other people looking at your answers. Just if you don't want to see other people's answers, don't look at the chat box. You can kind of move it off to the side if that's easier. But before we get started, does anybody have questions about kind of how things work? Because I know we only have a half an hour, so I will go through these now. But any questions at any time, please just let me know. I can stop anytime. This is being recorded, so you will all have it afterwards also. Okay, but first, just really quickly, I wanted to show you guys how they mark the board exam. Okay, so briefly, I could talk about this for the full half an hour, but I just want to talk about it briefly. So please remember, there's different categories and there's different groups. So I'm just going to expand the first one here for you guys. Okay, it's not letting me, so I'm gonna just move this out of the way. So you see how it says 1A, 1B, 2A, and 2B. So just think you need to study everything for the board exam. But the best way, if you don't know what to study first, is to go through questions and to go through case studies, because that involves critical thinking, the last part of the exam, and application. Okay, so critical thinking and application is 54% of the exam. So you don't only need to know the answers of things like what's perio, you know, what's gingivitis, what is bone loss, you know, those are the direct answers. But you need to be able to think critically, and you need to apply your knowledge to questions and case studies. Okay, so that's why it's so important. I'll just make this smaller, but I'm going to go through this quickly at the end for you guys in case you're not sure. Okay, actually this is the same picture, isn't it? So I can take this out. So yeah, so just please remember, even if you're just simply reading through the textbook, that won't help you, because you need to actually understand everything, because that makes a difference between passing the exam and not passing. Because I have so many students come to me afterwards and think that they did excellent on the exam, but then they don't pass and they don't know why. It's probably because in the case studies types of questions, they weren't thinking critically, because two answers are always the most correct. So let's go through some questions here. Now this is kind of an easier one, but I put it up here for a reason, and I'm not going to give you guys the reason yet, okay? So what do you guys think? So the question here is, after performing a periodontal probing on your client, you realize their 4mm pockets are not improving. Who do you refer them to for their next cleaning appointment? And I'll let you guys read the answers. You know, take your time. I will stop talking so you guys can think about the answers. And if you could please type your answer into the chat box. It is up to you if you want to send your answer to everybody or send it to only me. That is okay. It's totally up to you. But it does help me kind of see who's answering correctly, who's not, if I need to stop and talk about it more. If you guys all have the answer right, then that's telling me that I don't need to keep on talking about it, because you do understand. So this is what I do a lot in the Board Exam Prep Academy, because I don't simply want my students to get the answers wrong and then we move on. You know, I want to make sure that everybody's understanding. So thank you for letting me know your answers. And see, some of you guys are getting the answer wrong. So that's why I'm happy to talk about it, because this is a basic question here, but it is a case study and you guys have tons of things to think about, right? So even if I know you all know the answer, okay? But when you see a case study, there's usually 3 or 4 different components to it. You have to put those together and figure out the answer. So I'm going to talk about it, but yeah, a lot of you actually got the answer wrong today, but that's okay because I want to talk about it. So the answer is D. So let's read the question again. So after performing a probing on your client, you realize their 4mm pockets are not improving. Who do you refer them to for their next cleaning? So this case study is trying to trick you, because it's pretty much leading you in and saying you need to refer them to somebody, right? Because it says, plain and simple, who do you refer them to for their next cleaning? But what do you guys know about 4mm pockets? Just think in your head or type in the chat box. It's totally up to you. But what do you guys know about 4mm pockets? You should know at this point that yes, it is perio, but it's not serious. Yes, it's perio, but it is slight perio, early perio, depending on the textbook you look at. Is it moderate perio? No. So why would you be referring them to a perio specialist? In your Darby and Walsh, Mosby's, Saunders, all of them, it does not say to refer the client if it's early perio. It says moderate or higher. So the best answer is the last one, nobody, because you don't need to refer them. So does that make sense? And this is where, you know, there's a fine line, because could you refer them? Yes, but why? Why? That's almost like you're over-treating them. That's like telling your client or your patient that they need to brush 5 times a day every single day. Could they? Sure, but that's over-treating them. They don't have to. So on the board exam, that would be the wrong answer. If your question was, you know, how many times would you tell your patient to brush and floss? Brush twice a day, floss once a day. If you think the answer is brush 5 times a day, floss twice a day just to be safe, no, that's not the right answer, because you are over-treating them. And anytime you are over-treating somebody, there's a chance that they will say, oh, wow, I have to do a lot here. So I'm just going to do none of that, because there's no way that I'll be able to brush 5 times a day, but that's what my hygienist wants. So you know what? I'm just not going to brush at all. That's how things are, and that's the type of thinking that they want you to think. So does that make sense, you guys? So any questions about that though? Okay, so I don't see questions, so that is good. So this is why I put this in here. It may seem like a very simple question, because you're thinking, well, if it's perio, there's 4 millimeters, you're asking who I refer them to. Well, I wouldn't refer them to an endodontist for a root canal. A periodontist, yes. Would I refer them to another dentist? Well, you could, but is that the best answer? No. But the best answer is D, nobody, because with the 4 millimeter pockets, they don't need to see anybody except for you. Now, having that said, how often would you be telling your patient that they need to see you? Right, so 4 millimeter pockets is not advanced. Even if they had 4 millimeter pockets everywhere, say every single tooth, every single surface, that is still early perio. And anytime, yes, exactly, anytime you see perio, they should be coming in every 3 months. Honestly, they should be, okay? If they have 1 4 millimeter pocket and light plaque and light tartar, do they need to come in every 3 months? Probably not, but every 4.5 months is the next best thing, because clearly them coming in every 6 months or 9 months isn't working, so they need to come in more often to keep the gums healthy and under control. Okay, so let's move on to the next one though, so we can go through some more questions. So, okay, so this isn't a case study per se, but I put this in here because I was doing a session today and every student I talked to got this wrong. And no, you have to get this right. So the question is, you are writing the board exam and have stumped upon one question that you wish you could remember. The infectious agent for syphilis. What is that? You guys have to know this. It doesn't matter if you're taking the board exam in Canada, in the States, you guys have got to know this. So, and if you don't, that's okay, but this is a perfect example of you needing to go through oral pathology again. And I see that some of my students here are from the Board Exam Prep Academy, which is awesome, but go in your oral pathology unit, it's all right there. And we do have our oral pathology actually session on Wednesday, so we will be talking about this. So you will be a step ahead. And having that said, you guys, I don't expect you to remember everything, okay? Because that's impossible. But certain things I'm going to tell you, you have to know for the board exam because it has been on almost every single time, and this is that question. Yes, you may be able to see some of the answers from other people. Like if they're not clicking to privately send their answer to me, then you might be able to see the answer from other people. And that is okay, but just try not to look at that and just think about yourself, okay? And think about, well, that sounds horrible, but think about your answer. because sometimes the answers from other people are not right. So let's talk about it. Okay, so the answer is A. This is the only answer. None of these are correct. So when you're looking at syphilis, the infectious agent is A. For some reason, they want you guys to know that. You don't have to know it for the real world, but you have to know it for the board exam. So even if you got this wrong, that's okay. Make a note somewhere and make sure to look at that note just before you take the board exam. You will remember it and you will get this answer right, and then you'll think of me and say, thank you so much. Because trust me, it will be on the board exam. It always is. Okay, next question. So let's talk about a case study here, you guys. Okay, so I will read this out to you. Carmen admits she likes to drink and says her heavy drinking causes her to forget to brush her teeth daily. Carmen hasn't had her teeth cleaned in 10 years and has been booked at your office several times, but always cancels last minute. Most of her front teeth are decayed, and Carmen says she hates the look of them. So remember, in case studies, you get a lot of information. Break them down, okay? So I will give you guys a question, and then I'll go back to this slide here. So question. Actually, I don't think I need to go back to the slide in this case, because the question is, alcoholism is an unmet human need of. So what's the answer here? Because remember, in the case study, it talks about she is a heavy drinker. So I'm not saying she's an alcoholic, but, you know, in this question, it's just simply asking about alcoholism. So if she was, even if she's a heavy drinker, she may not be an alcoholic, but being a heavy drinker isn't healthy, right? So that is an unmet human need of one of these. So what do you guys think? And the answers are interesting, actually, so far. So, oh, and I don't hear anybody's audio, but somebody says that somebody's audio is on. I can actually turn that off. So let me do that for people. Oh, no, I don't want to turn off mine. Can somebody turn off your audio, please? Actually, wait, I figured out how to do that. Yeah, okay, I see who it was, not a problem, but I did turn it off now, so you guys should only hear me. So thank you for letting me know, because I actually turn off my speakers, because if I have the speakers on, then you guys hear a slight echo, so I did turn that off. Okay, awesome. So what do you guys think this answer is? And please look at the answers. And I will talk about it because there's a lot of wrong answers here, but that's okay. So let's talk about it. Let's see. Okay. So the answer is protection from health risks. Now, a lot of you said that the answer was freedom from anxiety and stress. Now, technically, that could be the right answer because clearly if you're drinking, you're probably not the happiest person, right? So you're probably stressed about something, but that's not the best answer. Freedom from anxiety and stress is more about the patient telling you they're anxious about their appointment, or the patient telling you they're going through a stressful time in their life and they're grinding their teeth and they need a night guard. Or if the patient's telling you they don't come to the dentist because they're scared or they have anxiety. Now, some of you also picked the last one too, which could be the right answer. So alcoholism is an unmet human need of, and some of you picked responsibility for oral health. That could be the right answer because you are responsible for your health. But for alcoholism, is it about your oral health? Not necessarily. I mean, it is, but that's not the best answer. This would be if responsibility for oral health is more if you know you have a cavity, but you don't want to get it fixed because you can't be bothered, you don't have the time. Or if you know you have an amalgam that needs to be replaced because it's leaking, that is more responsibility for oral health. So does that make sense? So the best answer is C, protection from health risks, because that's not healthy. Heavy drinking isn't healthy for you. It's not good for the mouth either, but the best answer is C. Now, is anybody confused about that? Because this was a tricky one. If you are confused, please stop me and let me know. But let's go through the next question, and I will move back to the case study because this one you may have to see the case study. So this question is, what is the first thing that you will ask, what is the first thing that you will talk to Carmen about? So I'll move to the case study in a second, but read through the questions first. So what is the first thing you will talk to Carmen about? And let's move back to the case study for a second. Here we go. So quickly here. So Carmen admits she likes to drink. She knows she is a heavy drinker who forgets to brush her teeth daily. She hasn't had her teeth cleaned in 10 years. She has been booked at the office but keeps on canceling. Most of her front teeth have cavities, and she hates the look of them. So what would you talk to her first about? What is the first thing you will talk to Carmen about? And I'll explain this in a second. Because in this case study, there's a lot happening. And this isn't an easy question because you have to remember, in fact, I might have even talked about it yesterday in our session, about how to prioritize certain unmet human needs. And typically, anytime there's a case study on the exam, they want you to think about those unmet human needs and how you can fix them or solve them, or how you can be your dental hygiene, dental assisting self and go through the appointment and take care of the most important things first. Okay, so let's talk about it here. Okay, yes, so the answer is A. I think most of you did have that. Now, this is a tricky one because it could have been a couple things here, right? Because do you remember, let's go back to the case study. So Carmen hates the look of her teeth. So I would be more inclined to say you should talk about how her teeth look first, right? Because that's her chief complaint. And typically, you take care of pain and chief complaint first. Does everybody remember me saying that if you were here yesterday? But in this case, you need to actually take care of the most simple thing first. If the case study was worded in such a way where it said, Carmen hates the look of her teeth and that's all she wants you to take care of, then you would look at that first. But since it doesn't mention that, it just simply says that she hates the look of her teeth, you need to think about it differently. The easiest thing to fix first is her toothbrush. She needs to be brushing daily. And you could even put a spin on that and say, your teeth have cavities because you're not brushing daily. Let's say you wanted to fix her chief complaint first about her hating the look of them. Well, she hates the look of them because she has cavities in her teeth. How would you fix that? She needs a filling or two or more. How did those cavities happen? Because she doesn't brush her teeth every day. If it said she drinks 10 pops a day, and she hates the look of her teeth, well, that's a different conversation, and that would be a different answer, because then you would need to talk about sugar, and that's why her teeth look the way they do. But does everybody understand why? Oh, I'm sorry. I think I just gave you another answer here. Oh, no, we talked about that one. Does everybody understand why the answer is A and not C? Because I would have thought C off the top of my head, because that's her chief complaint. But it was the way the case study was worded. It didn't say that that is the reason why she's here for the appointment. It didn't say that's her main concern and that's all she wants fixed. We need to look at the least invasive thing first. Okay? Okay, so let's move on because I don't see questions yet. Oh, wait. Raj is saying, so if she hasn't mentioned about her getting her teeth fixed, would the answer be B? So if she didn't mention about getting her teeth fixed, would the answer be B? Not necessarily, and I say no because as a hygienist, you would never tell somebody to stop smoking. You would never tell somebody that they need to stop drinking. So this would actually never be an answer. The only time that that would be an answer is if the patient's saying to you, you know, I drink a lot. I'm just trying to think of something here. If she was coming to you because she wanted you to help her with her drinking, like if she was coming to you saying, you know what, I don't like my teeth, I drink a lot, I kind of feel like I need to stop drinking, what do you think? Like, is it okay to drink as much as I do? Then you could lead the conversation to say, well, you shouldn't drink as much, but as a healthcare professional, as an oral healthcare professional, that will never be your first priority unless that's what the appointment's for. Like if you booked an appointment specifically to talk about quitting smoking because the patient called you and said that she's ready to quit and you said last time that you would help her, then yes, you would talk about that. But in this case, you want to start with the least invasive thing, or the chief complaint, or if the patient's in pain. And I took this case study actually from a CD, Dental Hygiene Comprehensive Review, I believe it was called. So I didn't make this up. This is actually from the actual CD. Okay, good, perfect. Because honestly, if you have questions, please let me know because case studies are hard. Okay, let's talk about another one. So I will read this one for you too. Virgie is an older lady who seems to have trouble getting in and out of the dental chair. And even as I'm talking, feel free to write down the key sort of points. She also appears to be having trouble breathing. She walked here because she doesn't have a car and hates the bus. As she was leaving, you noticed her cigarettes fall out of her purse. You ask her about them, and she admits to smoking a pack a day. She has a complete upper denture and says she loves it. She takes it out every night. She also says that she doesn't have time to care for her lower teeth. You notice thick, tenacious tartar. She brushes daily, and I can't see with my webcam. Let me move that. She brushes daily and doesn't understand why she needs to come see you to have her teeth cleaned. So look at all of the different avenues here and look at what this is saying, because this is an even more intense case study where they're talking about a lot more. So let's go through a question. Okay, the client smokes. What unmet human need is this? So remember how you had noticed the cigarettes falling out of her purse? You had asked her about it and she admits to smoking, I believe it was a pack a day. So you know that the client smokes. So you know when you're writing up her treatment plan, you need to come up with these unmet human needs, right? So which one would smoking fall under? And remember what I said about C and D. So I'll let you guys think of that for a second. I'm just gonna have some water here. And this is a tricky one too, because I'd say 3 answers are more correct, but you need to pick one, right? Okay, so I'm getting a few different answers, so let's talk about it. Okay, so the answer is D, protection from health risks. Now, smoking could fall under responsibility for oral health because, you know, smoking isn't good for the oral health. When C would be correct is, let's say the case study was talking about the patient had a squamous cell carcinoma a year or 2 ago. She's concerned with oral cancer. And then you notice the cigarettes falling out of her purse. That would almost be more responsibility for oral health because we know, or we should know, that smoking could be a cause of oral cancer. Smoking and alcohol together is a definite probable cause for oral cancer. So it could be C or D, but since this is just simply talking about smoking, then the best answer is D, protection from health risks. Some of you picked B, I believe, so skin and mucous membrane integrity of the head and neck. This is more, what would this be? Let's say the patient is chewing the insides of their cheeks. This would be more this. Let's say the patient has a cavity. This would be it too. So this actually falls under a lot, but smoking specifically is under a health risk. Another thing to think about for protection from health risks is if a patient ever admits to you they haven't seen a doctor in 10 years. Well, that's not good because how do they know they're healthy? that would be an unmet human need of protection from health risks. Yes, Raj actually made a good point. So skin and mucous membrane integrity of the head and neck. Think of more extraoral and intraoral lesions. So yes, you are absolutely right. So if the gums are bleeding, there's inflammation, she said, recession, so anything like that, think inside the mouth. Protection from health risks are more external. So if they're not going to the doctor, if they're smoking, if they're drinking, if they know that they need to take antibiotics prior to their cleanings and don't, that is more protection from health risks. Okay, let's move on here because time's going fast. Okay, so how can you discuss why cleanings are so important? And I'll let you guys read the answers to think about it. This is kind of a tricky one too, and it's 9:27 already. So see you guys, we are almost done. Time goes by super fast, eh? Half an hour is hard because I talk a lot. And I know that some of you did email me yesterday about the board exam boot camp that I have coming up on Wednesday. So if you want more case studies, more harder case studies, harder mock exam questions, I do have something called the board exam boot camp, which I do that for a full 2 hours. And they're hard questions though, they're not easy. So if you do a good job on those, you know that you'll be fine for the board exam. I have that Wednesday in the evening. If that's something that you would like to sign up for, it's 2 hours. The members of the Board Exam Prep Academy have that included in the membership, so don't sign up and pay if you're a member because you already have that. But they're a lot harder questions, and it's intense too. Yes, Raj, you are a member of the Board Exam Prep Academy, so you will actually have the rest of these questions. I will post them into our private Facebook group tonight. For the rest of you, if you're not a member, I do still put up the recording though on YouTube. It takes about a half an hour. So yeah, absolutely. It's just, Raj, I apologize. I just haven't had the chance to do that yet, but you do have that. Okay, guys, I'm sorry. So let's go through this here. So let's talk about it because you know what? I think everybody picked a different answer. I got a lot of A's too. Okay, so how can you discuss why cleanings are so important? The answer is A. So keep it simple, okay? Anytime you're not sure, keep it simple because they love to ask these types of questions. So you know what? All of these could be correct, but let me show you why they're not, okay? A is correct because it's simple. Show her the plaque, show her the calculus, because we're talking about how can you discuss why cleanings are so important. Show her the plaque, show her the calculus, and say, if you're not brushing every day, you can't take this off. Calculus, you can't take off. I can take off because we have the instruments. B is not correct. Can anybody tell me why? Because some of you picked B, but please tell me why B is not correct. Actually, you know what? It's the way the question is worded, so this may not make sense. So, okay. So I'm reading the question as if B is saying that you can see plaque in x-rays. So you can't. Does everybody know that you can't see plaque in x-rays? I hope so. Calculus, yes, you can if it's heavy, but you can't see plaque in x-rays. C is not the right answer because remember, you guys, in the case study, she takes her dentures out every night, or she takes her denture out every night. So why would you tell her she needs to do that when she's doing it? Think about that. And D is not correct because you would never, as silly as it sounds, you would never tell a patient to brush 3 times a day. The board exam doesn't like that. Do I tell patients to brush 3 times a day? Yes. I say, okay, you're a heavy smoker, you have stain, you need to brush 3 times a day. You know, take your toothbrush at work and brush after lunch. That will help you. But on the board exam, they want you to know to brush 2 times a day and floss once. That's it, okay? As silly as that sounds, I know, but that's the board exam for you. They are silly. So does everybody understand this though? If you don't, please let me know. And yes, Paula, I will have the recording up soon. I think it takes about 20 minutes, and I will put it on YouTube. I will add the link into the files for people who signed up, and I'll put it also in the Facebook group as well. So you will all have it. Because I know that some people signed up who couldn't come, because I completely understand it's the long weekend, right? But I figure, hey, I'm sure some of you or all of you are getting nervous for the exam, so I wanted to help. Yes, I did. Yep, I see everybody here, so that's perfect. Okay, you guys, you know what? We'll go over one more question. How's that? It's 9:33, so let's go over one more. Okay. So this is a good one. The patient is uneasy about her dental appointments and doesn't understand why she needs to come. This can be seen as A, B, C, or D. So think about the question here. What do you guys think? Look at the question. The patient is uneasy about her dental appointments and doesn't understand why she needs to come. Oh yes, I will go back to the case study. You're right. Let's do that. So there we go. Okay, perfect. Let's see here. Sorry guys, I should have looked to see which slide I was on. There we go. So the patient is uneasy about her dental appointments. That's one thing. And doesn't understand why she needs to come. That's two things, right? So which one are these? So yes, it's A and B. Now I think all of you got that right. I know that some of you picked a different answer, but then as soon as I pointed out that you had to look at two things, that is why the answer is A and B. And that's the thing about case studies, unfortunately. And this is where students get things wrong, because case studies are huge. You're not looking at one question, you're looking at 3, 4, or 5 or more. And you have to remember the case study, right? Because they like to trick you. In the answers, they may add answers that have nothing to do with the case study, and it kind of throws you off, and then you get the question wrong, right? So that's not good. But yeah, you guys, so it's past 9:30. I'm sure you all have something else to do, and I'll put up the recording right away. It takes about 20 minutes to process. But yeah, I will send the rest of these questions into the private Facebook group if you are a member. And if you're part of the board exam boot camp on Wednesday, I will send that to you too, because I think some of you are. Oh my gosh, yes. Raj, thank you. The blueprint. See, I would have forgotten, so thank you. Yes, so, and if you're a member of the Board Exam Prep Academy, make sure that you are signed up for the private Facebook page, because I've tried to sign up like 4 or 5 of you, which I think are here today. And I sent you the link by email, but not everybody has signed up. So if you're not part of the private page, I believe it's called Students of Dentalelle Tutoring. Yes, Students of Dentalelle Tutoring, please email me and I have to re-invite you because it is private. You can't see it unless I invite you. Okay, so I want to go over the blueprint quickly. So remember how I showed you guys, let's see here, this kind of picture here. So you see how there's different groups and different percentages. So it does help to know that. So I will actually post this for you all who did come today because you are here on the long weekend. It's only fair. But if you need something to study, so if you've taken the board exam before and you would have had something like this, okay? So the national average is in purple and your score is in blue. So let's say 1A, this person, you know, got about, this is kind of blurry, but it looks like less than 60%. So they need to study group 1A. And what I actually did is I took the time to look that up. I made a lot of phone calls to the committee who writes the board exams, and they actually told me the topics per group. Okay, so as an example, so group A, you need to know all of these topics. Okay, I kept it simple. So you obviously have to know the subcategories of ethics, culture, autonomy, instrumentation, but I just sort of kept the topics simple, right? So if you've taken the board exam before, and even if you haven't, it is good to know the different types of categories that you need to study. And I say this because case studies usually involves a little bit of each topic in a case study. So I will send you guys this. It might be just easier for me to post it on Facebook because you are all part of that Facebook group now. Not the private one, but the other one. So let me make a note of that. So you all should be a part of this one. Let's see, let me just add a slide here. So this is not the private one for the members, because if you are a member, you have access to the private one. But this one you are all a part of because you signed on for today. So I'll actually post the blueprint in there so you have it. So stay a part of this because I post things all the time. Okay, you guys, so just as an example, so I'll quickly go through this. And then group 1B, you have to study other things. But if you notice, some of the groups have the same topics, like group A, 1A, you need to study, for example, the medical emergencies. But it's the same thing for 1B also. That topic is in 1B also. Because remember, let me show you guys again. There's certain components, and the only reason why I'm talking about this, because it's so important to know all of these different topics. So let's say you did poorly on group 1A, and that's it. I would start to study that first. Still study the other topics, but study that first because clearly you need to, right? And then I talk about all of the different ones. And then the case studies, as I said, it talks about critical thinking and application, okay? So you need to know a little bit of everything. There, I'm sorry. I think I'm starting to lose my voice now. But, oh yes, I wanted to talk about ages, which isn't a huge thing, but in case studies, they pretty much try to average out the ages, so they're not always talking about teenagers or children or seniors. So you need to know about all the different age types for the Canadian and the American board exams. I talk about the categories a little bit more here. The percentages, very important. And I talk about it more here as well because of the case studies. You guys have to know this. And it even kind of tells you guys, now this is for the Canadian exam though, not for the American, so this may be a little bit different if you're taking the American, but look where it says here, case studies with 5 or 6 items per scenario. So you have to know 5 or 6 different things in that case study. So if you're not sure about one of the components, you will probably get that whole case study wrong. So that's why it's so important to study different types of topics. So I say the different types of topics. Like if you simply said to me, well, you know what? I did poorly on group 2A last time, so this is all I'm going to study. No, study everything, but this you may want to focus on because you had a hard time with that last time if you've taken the board exam before, but make sure to study everything because when it comes to case studies, that's where students mess up, okay? And that is what they have told me because I actually have a friend, a fellow dental hygienist who's part of the board exam committee. She can't tell me the answers, unfortunately. She can't tell me the questions, but she can tell me where students typically are wrong. Like I know the last time she was marking the board exams and she told me any and all of the case studies, students did not do well at all. The multiple choice questions, a lot of them actually did quite well, but a lot of students actually failed the board exam because they didn't obviously understand the case studies. So that's why it's so important to talk about it because I want you all to pass. because I know some of you have taken, you know, the board exam once or twice or more before. I want you guys to pass. That's the whole point, right? So yeah, so I will post this on the Facebook page. I may have to post a link. I don't know if I can just post a file. I can post a file in the private Facebook page, but I don't think I can post it in our main page. So I will post that for you. Yes, and somebody's just asking me if yes, so I can just send her a message. So if you are a member, you know what, feel free to send me this if you still have it in your email, and then I will let you know which parts you have to focus on. So it does help you guys to be a member of the Board Exam Prep Academy, okay? It does help, because I wish I could help everybody. But you know, I do have a lot of students, so I help the students first, okay? So I'm just gonna make a quick note to that person. But does anybody have any questions? Any questions before we sign off? So this was a tricky case studies type here, you guys. This was not easy. Please go through some more case studies and go through some more questions, because it does help you. If you're interested in the board exam boot camp, feel free to just ask me, but I did have an advertisement on it in the Facebook page also. I have that Wednesday evening. It's a full 2 hours. Very, very tricky questions, but I do that on purpose, because if I give you guys easy questions, that's not helping anybody, right? Okay, so I don't see any questions. I will sign off then for now, so then that way I can post this as soon as possible. It usually takes about 20 minutes or so. So you're all awesome. Thank you so much for coming on your long weekend. Tomorrow is still a holiday though, right? So everybody just take it easy. You don't have to study as much tomorrow because it's a long weekend. Just take it easy, okay? Because I know that the board exam is fast approaching, but you all need to take it easy though too, because if you study too much, that's not good. And if you guys need anything, I'll leave my email. Feel free to email me. I am happy to help. Whoops, I think I just sent that to one person. Sorry. Let me send it to everybody, just so you have it. And make sure that you stay a part of this group. Where did I put it? Because I will have a lot of things on there, especially since the board exam is coming up. That looks funny. There we go. Okay, you guys, so I'll see everybody later. Thank you so much for coming on. I do hope this helped, and good luck. Happy studying, and I will hopefully see some of you guys very, very soon. See you later.